Welcome to part two of my interview with Dr. Mike DiTolla. Get ready for some additional fantastic insights from Dr. DiTolla relating to chairside technique, his current materials of choice, and some super insights regarding what he considers to be your top priorities in dentistry today. Thank you much for joining us. Please check out our sponsor, righttouch.com. Link is in below the video here. Great way for you as a dental practice to deepen the relationships you have with your patients, all done automatically. So please check out righttouch.com. And again, thank you. Please subscribe to our channel. And here we have Dr. Mike DiTolla, part two. Thanks much. You were on a podcast recently where you talked about how you like taking a case that would have been a prep case in the past and making it into a no prep case. Tell us more about why you like that approach.
Well, when I went to LVI back in 1995, the first class at LVI, and you remember these days, it was back when we thought microdental was the only lab that knew how to use Empress because they were so tied into LVI. And we had to prep 1.5 millimeters for these veneers when we were doing veneers back in the day. And Bill Dickerson and David Hornberg both loved the challenge of prepping deep, and they liked etching pink dentin. Even the closer you got to the nerve, the more excited they seem to get. And but we had to prep a lot to get these good aesthetic results. But by the same time, I kept having patients who we would do 10 teeth on them, and we did it strictly for aesthetic reasons. They would end up needing a root canal or two because of etching and bond, or because of me etching and bonding on this dent, and maybe somebody else would have got better results, but I just kept getting problems like this and staining at the margins from not getting a good bond. And but at the same time, the DenMat was pushing the no prep veneer concept, but they just didn't look good back in the day. The prep veneer definitely looked better, but I always felt guilty about prepping all this teeth away for the aesthetic change, and then the people who ended up needing endos. And so as no prep veneer continued to progress, and then all of a sudden we were able to use Emax at 0.3 of a millimeter for these veneers, and it kind of shocked the world because it was like, oh, now we've got really something pretty beautiful here, this nice translucent material that comes in 3 different translucencies, and we can do these veneers, but they still kind of look bulky because if the teeth are in the proper arch form, you're adding 0.3 of a millimeter to it. And so it's always like, oh, we should do minimal prep veneers where we just remove 0.3 of a millimeter and put it there. But now patients don't really like that, and there's no going back once you do that if they don't like them. And so I was craving a way to be able to do no preps but have them look really good. And so when Align came out with their Smile Architect software, and I got to be one of the beta testers, I told them, I said, I've been waiting for something like this for the last 30 years. This is amazing. And I alluded to it before. A patient who comes in and wants veneers and their teeth are all at weird different alignments, you really can't do that case unless you prep it. But if the patient is willing to wear aligners for 4 months, I can get the teeth where they need to be to make it a perfect no prep case. And as I mentioned earlier, we're going to tip them back to the lingual, a degree or two, so that when we put the 0.3 of a millimeter there, it's going to be fine. I saw a guy today where we're doing veneers on 7 through 10 and implant crowns on 6 and 11, and his teeth, the levels are all off. And I did that intentionally, Michael, because we're going to do veneers on these teeth, and his gingival levels on 8 and 9 were so different. So I intruded tooth number 8 so that his gingival levels now look perfect, but the teeth are different lengths, which is fine because we're going to fix that with the veneers. And so moving teeth, if you want to be an aesthetic restorative dentist, it's difficult to do it unless you feel comfortable moving teeth. And so maybe you don't want to get into full-on Invisalign cases, but the beauty of moving these teeth before to take a prep veneer case and turn it into a no prep case is, 50%, I would say 95% of the work. Well, put it this way, finishing an ortho case just by doing Invisalign and getting it to be finished and perfect, it can be difficult. But when you're just putting the teeth in the right place to do no prep veneers, they don't have to be perfect in terms of the orthodontics because the veneers are going to make them perfect. You're just trying to get the teeth into the right position so you don't have to prep 3 millimeters into this tooth, and the one that's really lingual position, we're going to put a 3 millimeter thick veneer on that, because optically they're never going to look the same. And so if a patient will just give me 4 months of wearing the aligners, most of them, when they hear we won't have to drill on their teeth, and we'll have to drill if we do it today, but if you wear these for 4 months, we won't have to drill at all. They're like, yeah, sign me up. How much is it? And now it's an
Mike,
Invisalign case plus the veneers.
interject with a couple questions here.
Sure.
For the no prep veneers, typically what's your restorative material of choice? Is it Emax?
Emax. It's
It's
still it's still Emax
Emax Press,
unless yeah,
right?
it's still Emax. Yeah,
And
Emax Press is my
those
favorite.
veneers are about how thick when you get them back from your laboratory.
You go right around 3/10 of a millimeter. We're
Okay.
usually pressed probably a little thicker and then hand finished down to that
And
thickness
and and
for
we
the most part.
know that properly constructed, if they've been pressed, not milled, but pressed, properly adhesively bonded, these are going to stand the test of time, right?
Absolutely,
Absolutely.
absolutely.
So
Yeah, in fact,
now my question becomes whether you are a couple years out of dental school or you've been doing it for 30, 40 years and you just saw this interview with Dr. Mike DiTolla, it's like, okay, well, where do I go next? So where does that guy or gal go? Next steps. They've really not been into this world yet. What would you give them as one, two, and three when it comes to education?
well, we're just starting to give Smile Architect lectures now on behalf of Align, myself and a friend of mine, Dr. Josh Austin, and there's other people, Dr. Carlos Soto doing it as well, and there's a lot of people showing this. And no prep, and I want to say one thing about no prep veneers before I forget, because I just impressed some. We just scanned some today. I pack cord for no prep veneers and which sounds crazy. I use a strong topical. We don't have to give any injections. I just use a strong topical, rinse it off, and then pack the cord around there. Because again, I want to retract that tissue, that half millimeter. Because if you no prep veneers, most dentists don't even pack a cord, and so it's very difficult for the technician to get the end of the veneer right to the gingiva. It's usually a little bit short, and we don't want the patient to see the edge of the veneer. So by moving the gingiva back half a millimeter with the cord, I scan with the cord in, then we take the cord out, gingiva rebounds, and then the veneers are just going to sneak just under the tissue and look perfect. So I'm so fanatical about cord packing that I cord pack on no prep veneers, which sounds weird to most dentists, but you get way better results. So I would say start with it. Well, you got to have a digital scanner because you got to be able to scan this and digitize it and be able to either have your laboratory do a smile design for you. But I want you to consider, even if you don't want to do Invisalign cases, just think about the power of turning a prep case into a no prep case and how much ease. There's no temporization. Temporary veneers are the biggest pain in the butt in dentistry. They leak like a sieve. The gingiva gets all irritated. So when you go to acid etch the preps, if the acid etch touches healthy gingiva, nothing happens. If it touches irritated gingiva, because there's been temporary veneers on for 2 weeks, it bleeds instantly, contaminating the surface. There's so many reasons to do no prep veneers versus prep veneers whenever possible. Take a Smile Architect course. Be comfortable with moving teeth, knowing you don't have to put them in the final position. You just have to get them close. And then with the veneers, everything is going to be taken care of. It basically doubles the case fee because now you're doing Invisalign and you're doing ortho and you're doing the restorative afterwards. And then really just consider doing more Invisalign to get more comfortable with it. But on those Smile Architect cases, again, they're less demanding in terms of the orthodontics because you can have some gorgeous veneers at the end. So I would start there because really there's not that much to learn about no prep veneer technique. The difficulties in veneer techniques are prepping, getting the dog legs right, the temporization, how to do all that. No prep veneers, the prep appointment is some pumice on the front of the tooth with a prophy cup. That's the prepping. I would still encourage you to pack a cord to get that retraction so you'll have the veneer slip under the gingiva. And then it's just straight bonding, and we're etching enamel, which is the greatest thing in the world. Get dry it off, see it all frosty. I love that. And there's zero chance of postoperative sensitivity when you do no prep veneers versus prep veneers. So I just can't think of a patient who I wouldn't want to take from a prep veneer case to
Right.
or crown and bridge case for that matter. You have to be able to move the teeth into the proper position prior to restoring if you want to get consistent great results.
Great information, Mike. Thank you very much. So now let's shift gears to a world that doesn't receive a lot of attention when it comes to digital impressioning, and that's removables. Are you using your intraoral scanner for removable impressions?
Well, my associate is. I was partially retired, but like you, I didn't go get new tires. But COVID happened, and so all the lectures and all the consulting agreements that I had to help companies develop products, they all stopped because everybody stopped traveling. And then we started doing some webinars, but all the lectures were slow to, like, Zoom was still a new thing then. Now it's pretty commonplace for you and I to hop on and do something like this. But pre-COVID, Zoom was just something that a few webinar people used. And so I was like, and I felt bad as a consultant too, because they were like, oh, can you try this product for us? I'm like, oh, I don't have a practice. So
Mhm.
I realized I wanted to get back into practice, but I wanted to, if I was going to get back into practice, I just wanted to do things I was passionate about, which is turning prep cases into no prep cases, doing veneers, doing Invisalign, and obstructive sleep apnea. So my associate does all the direct composites, does all the crowns on like second molars. I won't touch a second molar, Michael. It's just it's kind of like a religious thing with me. I think to just draw the line. I don't even know why we have second molars, to be honest. I think first molars are enough. I don't know. I want to talk to God about this one and see what's going on. So I really like anterior teeth. That's where I like to play. But yes, I've seen my associate scan with removable, and obviously that's where printing has really come in too. The digital dentures and the ability to try something in that really is going to mimic the final denture at the end of it. It's pretty amazing to see what technology has done there. And it's funny, removable. Jim used to make fun of the removable department all the time. Jim would be talking to the whole lab and he would say something confusing. And he'd say, I'll slow down for the removable people. That was always like the joke in the lab. And to see like digital dentistry come to removable, it's like finally they get an upgrade after like flasks and just everything that was in removable. But yeah, the printed dentures that we're seeing come back look amazing and they fit great. And you really can check the fit very early on with the trial denture to see how it's going to be. So yeah, it's pretty clear that digital impressions have gone from this thing that like, ooh, cutting edge, high tech people like. You get to do so much now when you scan the tooth. And then, even with our scanner, with the Align 5D Plus, one of the things it measures, it has a function called time lapse, where if you scan somebody this year, so we scan all new patients, Michael, and then any patients not having x-rays gets a wellness scan. And patients just accept treatment so much easily when they can see their teeth. You can manipulate the models, you can show them where they're hitting, you can show the crossbite and things like that. And so it's amazing. And you can do so much with these scans. So everybody's being scanned, and with time lapse, you can scan somebody this year and then scan them a year and a half later, and it'll show you how much their gingiva has receded. It'll show you how the wear facet has gotten deeper over time. And so you can see whether or not issues they have are active or not active. So even if digital scanners didn't take impressions and we were still taking polyvinyl ones, they're well worth it just for all the other things you can do for designing cases and stuff like that. And now you can add removable to that mix as well. So
Mike,
it's kind of the digital hub of your practice.
I want to share with you that before retiring from the dental lab field, one of the last things I was involved in was 3D printing out of high strength resins, partial dentures, the entire partial
Mm,
out of the major connector, out of a tissue colored resin. And what I realized after having surveyed many cases for partials is that typically there's a fair amount of lingual undercut available, particularly in the lower arch, and to an extent the upper arch as well. And there's interproximal lingual undercuts available as well. So with these high strength 3D printed uh, materials, what you can do is create a stay plate, and for that matter, a long-term partial denture where you're not incorporating any metal, you're engaging lingual undercuts. Some degree of
right.
buckle is necessary for encirclement, and you're using 3D print, high quality 3D printed materials for your denture teeth as well. Now, I exited from the dental lab industry as an owner, just as I had proven that this was achievable and getting great results. I don't know if that is going to grow, but it was an effective technique, and in my work for the VA, they were loving it as a replacement, certainly for stay plates. As you know, a lot of dentists coming out of dental school today aren't really comfortable with cutting a rest prep or a guide plane. I understand there's a lot more to learn in dentistry than there was years ago. So I do think that we will see more straightforward partial dentures being made via 3D printing in the years to come. And that'll be interesting to see how that progresses.
Yeah, that sounds like a great idea, and that sounds like a great product. I mean, patients have always shown a preference for Valplast over cast metal partials, even though Valplast, Gordon calls it like the gingival stripper, because it doesn't have the same kind of rest preps and guide planes and stuff. But patients have shown a preference for, non-metallic removable prosthetics. And one other thing that just popped into my mind that I've been doing that I think smaller labs can do to compete with the larger labs is on some of these aesthetic cases. When Cindy and I design the case, whether it's with Invisalign or without the veneers, she's doing this thing now for me called Trial Smile, where, and we're doing this especially for people like, I have a woman who's getting married in a couple months, and we're doing veneers on her. Her teeth already look great, but she wants veneers. And so these are the cases that make me nervous. I like when somebody comes in, their smile's at 3, and we're going to take them to a 9, 8.5 or 9. Those are
Right.
great.
Yeah.
This woman's at an 8.5, and we're trying to take her to a 9.5. And this is where things get difficult. And so what this Trial Smile is, it's really easy for Cindy to do this and not very expensive. We'll have everything all designed. And it's one thing you can show it to the patient, say, look what it is. Or we used to take a diagnostic wax up and make a putty matrix and squirt some Luxatemp in and put it in their mouth, but it was kind of bulky and I don't know, it was so-so. But now she'll actually make PMMA temporaries for me, and they're available in all the Vita shades. And she can quickly, from that design, spit out PMMAs. And so now we put them in and get the patient to look at them before she makes the EMAX, and we get their feedback. Oh, this looks a little long. These look great. And then we have her make them, and we just know, and the patient has in their mind during the seat appointment, these are going to look amazing because we've already seen what they're going to look like. I'd like to see smaller labs offer that level of service where when you're making these big aesthetic changes on somebody, in fact, I'm not even in the room. When we try in veneers, Michael, I try them in just to see how they fit. And then I leave the room so my assistant can go with the big mirror and the patient, and they can talk, because I don't
Yeah.
want to say to the patient, these look amazing. What do you think? You must think the same, because if there's something they don't like, I don't want them to think they have to, like, it's not like I even made them, but I don't want them to think they have to approve of them because I like them, so I'll leave the room. But I'd like to see smaller labs do some of these trial restorations, whether you print them or whether you mill them, something like PMMA that looks halfway decent and comes in all the Vita shades, just to give the patient an idea what it's going to look like in their mouth. It's the same cost as a diagnostic wax up. It's just one that you can try in their mouth, and they can even go home, with them in their mouth. I mean, they'll fall out. They're just in with try and cement, but they can take pictures. A lot of times patients are FaceTiming their kids or their moms asking, what do you think? And it's really neat. Again, it's technology being able to let a patient experience, and that with the utmost confidence, the patient likes what's going in instead of just putting them in and hoping the patient likes it.
And that's a really great point. And again, laboratory, large or small, number one, I can say this as a former technician and lab owner, you can't just tune out and worry about what's the score of the baseball game. You've got to stay with it and stay on it, on top of your fundamental knowledge of dentistry and dental technology, fit, function, and aesthetics. What does that mean? And there's a lot of people, and I'm sorry to put it this way, a lot of people in dental technology who lack strong foundations. They don't really take the time to fully understand what we're trying to replace, and that's a shame. My dad's generation, he was a Navy trained dental technician. He had strong fundamentals. I had very strong fundamentals and developed a love for material science as well. So we need more laboratory technicians, more lab owners who really are pulling back separate from the digital world and saying, what are the fundamentals involved here? What did God in her wisdom do when she created a molar? How is a molar different than a central? There's important things for technicians to know. And beyond that, when it comes to the world of complete dentures, absolutely, there is a degree of knowledge that technicians should have, because now it's the empty cave. And like Michelangelo with the block of marble, you're being asked to create something out of nothing. And that requires more than just worrying about, hey, how are we going to get the acrylic created like they did in my dad's generation? This is a whole different world now. So there is, in my view, an increased expectation for intellectual educational integrity on the part of technicians and lab owners. So that's my soapbox on that subject, about something that I care about very deeply. Mike, I'm going to ask you two questions that are a bit out of the box, but you've been around dentistry now since the 1980s. I believe was your dad a dentist?
He was, yeah.
And so you've been around. I mean, it's in your blood, like me as well. So I'm going to ask you two different questions. One is meant for the dentist, younger dentist, maybe just out of school or been out of school for a couple of years. As you know, big chunk of them now are women. In some schools, it's the majority. So I'm a younger dentist, and I am saying to you at the bar, at the midwinter, Dr. DiTolla, what are the three most important things for me to pay attention to as a young dentist? What would you tell me?
Um, well, the first thing, I was giving a lecture in Pennsylvania a couple of years ago, and actually just before COVID. And I was sitting at the table at lunch, at the lunch break with a couple of recent graduates who were there. And I always like talking to recent graduates. And I love when dental schools let me come in and actually talk to the students that are still there. It's wonderful. And especially like in Loma Linda, because they let me go in and teach the reverse prep technique, even though they're not teaching that, they're teaching them the regular way to do it. They let me come in with burr kits. And I see these kids who are doing third year dental students, the D3s, and they're doing this prep technique for the first time and nailing it with these gorgeous looking preps. So it doesn't take an experienced dentist to do that. So don't feel like you need to have a great set of hands. Don't feel like if you graduated in the bottom 20% of your class or the middle of your class or wherever that you need to have a great set of hands. I'm living proof of that. And I'm not saying that the reverse preparation technique is the only way to prep teeth, but continue to explore for ways to get better, and don't think that sheer repetition is going to do it, because it didn't do it for me. Prepping a lot of crowns, I did not get better at just prepping. I mean, I probably got faster, but I don't think I got better until I incorporated that reverse prep technique. Take advantage of technology. Take advantage of, and actually, the dentists that I talk to, it's more the older dentists, Michael, who don't want to share their preps and don't want feedback from the technicians, who are like, I've been doing this 35 years. I don't need a technician to look and tell me if I'm done prepping. The younger dentists are much more willing to accept that kind of coaching from a CDT or a laboratory technician, because of the fact that when I was sitting at lunch, I talked to this dentist who had just graduated the year before, and I said, how many crowns did you do to graduate? And he said, I did 6. I said, whoa. He said, how many did you do to graduate? I said, we had to do 25, which still didn't seem like a lot then, 25, but it was more than 6. I said, how many endo procedures did you do? He said, 3. I said, 3? I don't, I said, how many did you do? I go, I don't know, 30 maybe? I'm not sure. He said, yeah, I know it's not a lot. I really wish I would have got the chance to do a molar. I said, you didn't do a molar endo in dental school? He said, well, we did one on an extracted tooth. I said, yeah, it turns out it's a lot tougher when it's still in the jawbone. That's more the challenge of like anesthetizing and being able to do it when you can't just watch the file come out of the end of the tooth. And so, just for whatever reason, and part of it's because dental schools have raised their fees. It used to be super affordable to go there, but they've raised their fees. And so it's not as obvious a choice for some people to go to there, versus like a Delta PPO or something like that. So there's less patients coming in, so there's less for them to do, and more things they have to learn. So and my dad did even more dentistry to graduate when he graduated, and they were sectioning teeth and doing all kinds of crazy stuff that we never did. So it just seems like there's less and less of a focus as there's more and more stuff to learn, perhaps. So I would say I would go to a Pacific Dental. I would go to an Aspen, and I would go somewhere to get my speed up and just get some experience. And frankly, to make your mistakes, I guess, somewhere else before you do it in your own private practice. Take advantage of technology and take advantage of things like the reverse preparation technique. And the other thing I would say is don't ignore your mental health right from the start, which is something I did for a long, long, long time. And I do have a mental health lecture that I give now where I talk about this. It doesn't get talked about much in dentistry, and I wish it would. So if somebody has to do it, I want to be one of the people who is doing it and be able to share my story. And because what I've started doing with therapy has certainly made dentistry, parenting, I'm better as a friend, I'm better as whatever, in lots of different ways than I was before. And I'm much more willing to accept help from other people, whether it's therapists or whether it's dentist mentors or things like that. Find a mentor. If you're a young dentist, find somebody who is doing it the way you want to do it. And they should be willing to give back to you, because we've all had mentors of our own. I mentioned, Bill Strupp, and Bob Lowe is one of mine, and Harold Chevelle. And there's lots of people who I just looked up to and tried to imitate and do. And again, to try to get preps like Bill Strupp's, I had to do the reverse preparation technique to even get close to what he can do. So yeah, find a mentor as well. Most of us are
Mike,
willing to.
those are all great insights. Before we go on to this next question that I have, tell us more about mental health in dentistry, and why you perhaps maybe it's been an overlooked subject, and why you consider it to be important.
I mean, it's just over. I mean, I think it's kind of overlooked or has been historically overlooked, just generally in society. There was a stigma associated with going to therapy or a head shrinker or whatever you want to call it. Man, I certainly grew up at a time where my parents didn't, go to any kind of therapy or didn't feel the need to. And just in a general sense, I feel like anybody who has the opportunity to go talk to a trained professional who's like an unbiased observer who can give you feedback on whether it's parenting or whether it's issues that you're having. Anybody who goes and talks to somebody like this, I think, is going to have a beneficial experience from it. For me, it was more around the fact that dentistry is a difficult, stressful profession. And it's not to say that other professions aren't stressful, but this is particularly stressful while we're working on, people in close quarters. We're hurting them. Everywhere else in medical, if you're having your foot operated on, your hand operated on, they put you under. We have to be like psychologists at the same time. Everybody's awake for all the dentistry, which is weird. This is the one
Right.
profession where everybody's awake and not asleep. And you half the time I'm hoping the patient will just pass out in the middle of it so I can finish the prep without needing their cooperation.
Right.
But it is stressful and it kind of takes its toll. And whether it's dentists having anger management issues with the staff or the kind of demands we put on ourselves where you put a filling in and it breaks 6 months later and you do another one and then it breaks again and you don't know what the patient's doing, but we tend to take this all on ourselves, and the older you get, the worse it gets. And so there's a book called The Body Keeps the Score, and it's about trauma and the effect that it has. And we can repress memories or try not to deal with things,
Yeah.
but our body keeps the score. It never forgets. And it will start to show up in terms of health issues, whether it's depression, anxiety. I've suffered from dissociative panic attacks since I was 13 years old, never knew what they are, was too ashamed to tell anybody because honestly, I was afraid I would be put in a mental hospital if I told somebody what I was really going through. And it would take decades before I
Yeah.
would get into therapy and start working on this issue. And it continues to this day, but I'm able to be so much better with patients and so much better with staff having done this. And so I just basically go out and share my story and talk about the things before I went to therapy, what I was doing to try to manage myself, drugs and alcohol, and trying to, just all these inefficient ways of trying to make myself feel better or feel okay and be comfortable in my own skin. I just want to be able to, because every time I give this talk, I'll have at least 10 or 12 dentists who come up afterwards and talk about their panic attacks, being taken from the office to the hospital in an office because they didn't know what was happening and not being sure, being afraid of when's the next one going to happen. Is the next time I do a root canal, I'm going to have another panic attack. And there are ways in therapy to deal with this and get ahead of it so that it doesn't bother you. And your enjoyment in life and your enjoyment of the people around you that you love just goes up as well. So I'll give my email address at the end because I'd love to hear from anybody who just wants to talk about it or wants to hear the type of therapies. I've done several different types of therapies at different portions of the last 15 years of my life, and they've all been extremely beneficial in helping me in one way or another be able to get to something that I couldn't get in the other type or the traditional type of talk therapy as I've tried these other therapies and been able to make peace with myself and be more comfortable in my own skin.
Mike, thank you for sharing that.
Yeah.
As we go through life, we have experiences, and some of those experiences put us in a mindset where we go backwards. Sometimes we go to a very dark place and it's life ending. We don't want that.
Okay.
And the resources are there in our world today, the United States, where there's nothing wrong with getting that support that you need, whether it's the professional support or the friends or the family. And I'll share with you personally, I've had my challenges in life. My dad used to say, wisdom is the summation of experience, mostly your mistakes. Well, if you can learn from those mistakes and get better and have a perspective of understanding and humility and respect and a cherishment for love and a sense of gratitude, you're going to have a life well lived. But what I want to do is underline for you what I saw in my almost 50 years working for dentists. It is a very demanding profession, both physically and mentally. You are working on human beings that most of the time don't want to be there. And how many businesses, how many professions are like that? You spoke to this. So kudos to you as a viewer who is a dentist or is chairside or in, it doesn't matter, even if you're in the office, dentistry is an extremely noble profession, worthy of tremendous respect. But you've got to balance that out, particularly if you're chairside, with, hey, every day you're an athlete. It's like you're playing golf, you're in the NBA. You've got to take care of your body and you've got to take care of your mind. And that's different than a lot of other jobs in the world because there's a strong demand. You're on stage dealing with the public, doing something where there is a great degree of sensitivity on the part of the patient. So taking care of yourself, going back to your point, and I'm reinforcing it, Mike, is job one because you can't be good for your coworkers, you can't be good for your patients if you're not being good to yourself. Would you agree?
Yeah, I agree. And not only that, I think we do hear what we do hear a lot about is dental burnout. And I really think the majority of dental burnout is just untreated mental health issues. I really honestly believe that it's not being burned out with what you're doing at work. It's being dissatisfied with how you feel while you're doing this work,
Yeah,
which is really not
and we
about the
know
work
that that
itself.
burnout typically happens after time, which leads me to my next and final question. We talked about the younger guy, the younger gal, right? And you had some great insights for them. Now let's talk about the individual. They've been doing it for a good number of years, and they're thinking about retirement, and they've got their day in and day out challenges, and they don't really have yet it all figured out yet for how to best position their practice as a valuable asset, which will be sold either to someone coming in as another wants to be a solo practitioner or create a small group or sell it to a corporation. When you think about the things that from a black and white perspective financially create a valuable practice and the things that create a valuable practice when it comes to the culture and the team, what would you be telling me in my 40s and 50s? Hey, Mike, here's what I think you should be thinking about so that these next 10, 20 years are happy and productive and you've created a business that's going to have good value when it comes time to selling it. What are your thoughts there?
Yeah, well, you can't ignore technology. You just can't ignore technology because you think you're going to retire or sell the practice in 10 or 15 years. It's not attractive. And when somebody's buying it, whether it's somebody who comes out of school or spent a couple of years at a at a DSO and is now ready to buy their own practice, they're going to want to see a practice that is up to date and patients are used to being treated that way and used to that technology. So you can't ignore technology and really kind of mail it in. And I have seen a lot of dentists who really haven't done that. And they've gotten older. They wanted to practice less because it is demanding. So they go from 4 days a week to 3 to 2.5 days a week. And so the production, all the numbers just kind of shrink and dwindle down. And then they're ready to sell it. It's worth, half as much as it would have been
Right.
10 years ago. It's amazing to me how many of the dentists that I know that are maybe 10 years older than me are selling to DSOs. I mean, this is something that it never existed before. It was just basically looking for a recent grad who maybe you could mentor for a while and bring them in and take this over. But the DSOs a lot of time will want you to stick around for 3 to 4 years, and you may not like how they run the practice because it's definitely more of a bean counting way of running the practice while they have you on there and you serve out your time there. But it's certainly a great way, especially if you believe in the DSO and what they're doing, to become part of that as well. So there's just so many different options. We talked about a consultant we both know, Carrie Strain, who is now doing the same thing and assembling practices and help improving these practices too by bringing these basic business concepts in and really making sure the staff lives those as they go through their day. So there's so many options available now to be able to do it, but just make sure keep the practice going as though you were going to do it for another 30 years, even if you're not going to, because that's what makes it attractive to people. Don't shrink away, and don't be afraid to learn new things either. And don't be afraid to get an associate and let them do the things you don't want to do. I came back and bought this practice knowing I was only going to do obstructive sleep apnea, Invisalign, and veneers. And it's great. There's no days where I go in, I'll look at my associate's schedule. I'm like, oh, he's got to take out tooth number 1 and tooth number 16 on that patient. I look at it and kind of cringe, and I pat him in the back. I go, God, you're so much braver than I am. And he's, oh, I like doing this. I'm like, oh, thank God. I don't. And so everything on my schedule is stuff that I like. Imagine you don't have to do class two composites if you don't want to. You just have to have an associate who does them. But I might get into them when I can start printing them and doing them that way, because now it feels like crown and bridge to me. So yeah, but you can't like just start referring everything out and have the practice shrink. Find, I mean, it's hard to like, I don't want to do endo anymore because I've got endodontists, three of them within like 2 miles of the office that all have, 3D cone beam machines and can see 3D anatomy and what they're
Yeah.
doing. And some of them are using gentle wave, and I'm not going to compete with that. So do what you love and just continue to practice like you're not selling it in 10 years, like you're going to go for 30 more years, and it'll be
Mike,
worth way more when you do make that decision.
you make some really great points. There's something I want to go back to, um, and that relates to knowing how to understand the score, how to keep score. And you mentioned people like Kerry Strain. Kerry and his group, they do a wonderful job of helping dentists keep score and understanding what the numbers are. Like, can you talk about that for a moment? Why is it so important to get outside help? And with all due respect to the standard CPA, great value for many of them. But why would you want to consider someone like a Strain to provide insight on your practice?
Well, I mean, they just have a proven formula that has worked over and over. And the first time I worked with Kerry was my practice in Southern California, probably, 25 years ago. And Kerry was just getting started at the time. And at the time, he was doing stuff with Patterson. Patterson loved what he was doing, and how Patterson was seeing that the practices Kerry worked with ordered more sundries because they were doing more dentistry. And so they loved it. And so he and I went on the road and probably did, I don't know, 30 or 40 gigs together, when he would talk about the practice management and I would talk about the clinical. And hopefully it was a really valuable program for the dentist to be able to go in and see what's going on in their practice. You're gonna spend the hours at your practice you're going to spend regardless. Just yesterday, my using the strain template and the strain wording, my staff made 18 reactivation calls and got 6 patients in for appointments. 3 were hygiene and 3 were for restorative, and just little things like that. But it's the accountability of it as well, Michael. I don't see Kerry as a consultant, I see him more as a coach. And so the accountability is the same way. When I have a triathlon coach, I will try harder because I want the numbers to look good. It's something, and I don't know if that's like the people pleasing aspect of me. We haven't dealt with that in therapy yet, but maybe it's just that I want them to see the numbers. But you want the numbers to look good. You want to perform for your coach. And everybody needs a coach, whether it's Michael Jordan, Wayne Gretzky. Everybody
So,
has a
so
coach.
Mike,
And
I need to interject here because you made some really great points in our time today. You made this point about having mentors, right? And now
yeah,
you used another word, coaches. I think in dentistry, would you agree? We need both. We need the people we can look to as mentors, and we need the people, yeah, we're going to be hiring these people most often who are going to be our coaches. Would you agree with that?
yeah, we need clinical mentors, and then we need practice management based coaches to help us keep the numbers right. Because you're going to be there 8 hours a day for how many years you're going to practice. You might as well make sure that you got a good retirement all set up. And you know what? Your staff's probably not going to like it when you bring it in, because it does represent more work for them. Nobody likes making reactivation, or very few people like making it. But the accountability of having to send a sheet to Strain about how many calls you made that day and how many people you reactivated, just having to do that accountability, it's like working out with a partner versus working out alone. You'll show up for that 6 a.m. workout because you don't want to be the flake who doesn't show up. But if it's just you by yourself, you might sleep in. So yeah,
Yeah,
I think it's fantastic.
yeah, yeah. Mike, absolutely wonderful advice. Thank you so much for this time together. I know that we could go on for hours talking about the ins and outs of dentistry and life outside of dentistry. And I think that's one of the great points about our time together today. You really, I think, helped underline this point that your life outside of dentistry is just as important as your life in it, and to do what you need to do so that you're thriving both when you're there at the dental office and when you're not there. And I think we all learn through life's experiences, and you've learned, hey, this is what I need to do in order to thrive as a human being, to thrive when I'm out in dentistry, to thrive when I'm not in dentistry, which means whether it's a fly fish or on a road bike or whatever it is that's bringing you joy in life. It's that balance that's very, very important for all of us. And you do
Oh yeah,
a great job of that. And thank you so much for your
trying.
contribution to dentistry. I know there are people out there today who would love to be able to reach out to you if they've got a question or want some advice. Are you willing to share with us your contact information?
Yeah, of course. They can
Your
email
email.
me at at MC DiTolla. So M like Mike, C like Christopher, DiTolla, DITOLLA at mac.com. And that's the easiest way to get in touch with me. I don't do as much as I should on social media. Obviously, we created this huge channel on YouTube at Glidewell, but I just never took the time to do like a personal one. And I really don't spend much time on social media. I'm kind of glad because I have some friends who are dentists who are kind of addicted to it. And yeah, it doesn't make me happy. It doesn't spark joy
Yeah.
inside me. I'd rather watch somebody canoeing and fly fishing or fishing. And I love the sound of water lapping against the canoe. So I kind of do that as my relaxation rather than scroll through
So let
Instagram.
me
So
let
yeah,
me
email's the easiest way to reach me.
absolutely. Well, thank you for sharing that. Then my other question is if somebody wants to see you out and about speaking, you're going to be at the Midwinter, you're speaking at a lab day, is that right?
Yeah.
Okay. And then beyond that, are you doing any other either video-based or traveling speaking engagements in 25?
Yeah, I don't have the dates in front of me, but I'm doing some for online, doing some for Ivoclar across the country, and you'll be able to see it. Or if you email me and want to know if I'm going to be, I know I'm in St. Louis, I know I'm in Colorado Springs. I just don't have the dates right in front of me, but I am getting, after COVID, I kind of enjoyed not traveling, to be honest, and then I started getting the itch. And I was like, I want to get back out there, and I just miss being around dentists and talking to them and being able to offer whatever kind of hope or experience I can, and also learning from them as well. And it's a much more meaningful interaction to do it in person with them versus a webinar where I'm just talking and they're listening. So I'm looking forward to getting back and doing lots of live lectures in 2025 and beyond. But yeah, if anybody wants to know if they'll be in their city, just contact me and I'll let them know. But otherwise, hopefully your dental societies will let you know. But I do host every year Henry Schein's big meeting called Thrive Live in Las Vegas. And I love hosting meetings. I used to host the CEREC meetings, and I love hosting these meetings because really all I have to do is introduce some amazing speakers and I just tell jokes. I just go up on stage and keep people awake between the speakers and tell jokes
Mike,
and do
I'm
little
going to
pre-recorded
interrupt
things.
you because you know this, I told you, I saw you at a CEREC meeting years ago before Martin Short and Steve Martin came on, and you killed the audience. You were far funnier than guys out of Hollywood. You are one of the most entertaining people God has made for the world of dentistry and beyond. So,
Oh,
yeah, I can understand why you like being up there because you know how to make people laugh, and that is a wonderful gift. And I'm glad you still want to share that as well. Mike, thank you
thank you,
so
Michael.
much for your time today. I know that everyone who has the privilege, the opportunity of watching you share what you just shared with us today will savor it and put it and hopefully put it to good use. So on that note, thank you, and to our audience, thank you for joining us on Dental Insight today. Until next time, be well. We will see you again soon. Thank you very much.